Thank you very much for the chance to share some thoughts regarding where we are on 1990. And thanks especially for the organizers for putting together a really, really amazing set of activities for us this week. So thank you very much. I just want to maybe begin by reminding us where we are in relation to the epidemic. Sub-Saharan Africa continues to be the epicenter of the epidemic, and about almost 70% of people living with HIV are located in Sub-Saharan Africa. And if you look at the differences between Western Central Africa versus Eastern and Southern Africa, actually Eastern and Southern Africa is home to about half the people living with HIV in the world. So really this is the area that there's a lot of challenges. And Western Central Africa is home to about 17% of people living with HIV. And you can see the figures there in terms of the number of deaths, in terms of the number of new infections, as well as the people living with HIV. So I was asked to talk about where we are on the road to 1990, and I was asked to talk specifically about progress in prevention and treatment. And in terms of prevention, when I look at it, to me, I think prevention, the road to prevention in Sub-Saharan Africa is a little bit like this. And this is actually what happened to us the other day when we were driving in Uganda, and then it rained, and then we couldn't drive any further. So the road is really difficult. The road is really challenging. If you look at the number of new infections in Eastern and Southern Africa, they have gone down since 2010 to 2016 by about 24%. But you can see that the trend is very low, and it's clear that we will not meet the 2020 targets. And we really will need to think, and I think that two presenters that were speaking have indicated to us the challenges around, even in a successful country like Rwanda. But the good news is that if you look at the panel on the right, I think it's on the right for you, is that there's been a significant decline in new infections, 56% in Eastern and Southern Africa. So if you look at how people living with new infections are distributed in Eastern and Southern Africa, South Africa continues to be the main epicenter of the epidemic, and 1/3 of people living, of new infections were in Southern Africa, followed by Mozambique and Kenya. So it just gives you a sense that really the new infections are still concentrated in Southern Africa, in the region, proportionately. And if you look at the percent change in new infections, which is the panel, I think, on your right, the 24% I was indicating that has the decline since 2010. Zimbabwe had the greatest reduction, it's at about 40%, followed by Mozambique and Uganda. And in a number of countries like Madagascar, Ethiopia, Eritrea, there was actually an increase proportionately in terms of the new infections. If we look at the same situation in Western Central Africa, we find, again, the road to prevention there is just is also quite difficult. And there's been just only a 9% decline in new infections since 2010. And I think this continues to be a challenge. As well, the number of new infections among children in Western Central Africa, it's gone down, but it's only gone down by 1/3, again, compared to 56% in Eastern and Southern Africa. And I think it goes to show some of the challenges that we have, particularly in that region. In Western Central Africa, the epicenter of the epidemic is Nigeria, and fully 59% of new infections in 2016 were in Nigeria, followed by Cameroon and Ghana and the other countries there. And when you look at the percent change in new infections since 2010, the country that registered the greatest success in terms of reduction is Guinea-Bissau, followed by Burundi and Senegal. And in fact, quite a number of countries registered increases, for example, Ghana, Liberia, and Congo. we were just looking at the data from Rwanda presented by the two colleagues, and we all know that girls are more likely to acquire HIV than boys, and this is showing the girls between 15 and 19 years and the male counterparts. But what is really interesting to me is if you look at the differentials, they're not the same across all countries. If you look, you can see, for example, so the countries on the left, for example, Burundi, is almost the same number of boys and girls acquiring HIV. But if you go to the right where you see South Africa, there's very, very significant differentials. And I think there are many explanations for this, but I think it's important to keep in mind that the differentials that we talk about are not the same across all countries. But there's good news, and actually some of the good news is coming from where I live in Uganda, and some really elegant research that has been done by the Rakai team that showed that there was a significant increase in delay of sexual debut among a cohort of a population they've been following. If you look at the arrows, the red arrows are highlighting the men reporting never having initiated sex on the left and on the right are the girls. And you can see over time, there's actually been an increase in the proportion who are saying that they have delayed sex. And to me, I think this is heartening because, as the previous speaker was saying, young people are our investments. And if this is what they are doing, I think we must be encouraged and we must continue to encourage these kinds of progress. And we cannot leave prevention without talking about prevention of mother-to-child transmission. I have just shown you the slides showing the decline in new infections among children. And I think countries have really made a lot of progress. And in many countries now, quite a good number of countries, they are reaching the 90% and over 90% coverage for pregnant women receiving ARVs for PMTCT. And this is great news indeed. The speaker from Rwanda was just talking about the key populations, and I really appreciate that she was emphasizing that because key populations in sub-Saharan Africa continue to be very, very important, and they make about 25%, they contribute to about 25% of new infections. So really, we will not be able to end new infections or have a significant dent in HIV if we do not really take into account the key populations and develop programs that are responsive to them. As far as prevention is concerned, there's been a new coalition that was launched, and I think many of your countries are members in trying to see how can we move forward in prevention. As you've seen, the road is quite difficult. Treatment, the road is a little bit less well, it's less complicated, I think, because treatment is normally the medicine. But just recently, the news we are hearing about DTG is cause for concern. But beginning with where countries are in relation to adopting the treat-all policies, all 21 countries in Eastern and Southern Africa have adopted the treat-all policy. But in Western Central Africa, only half the countries have adopted the policy. In relation to 1990, and I just want to make the point that the idea behind 1990 was really just to help us emphasize and look into viral suppression and not just the coverage. And the 1990 targets for 2020 was where we have 90% of people living with HIV know they have it. Those who know they have it, 90% are on treatment, and 90% of those on treatment are virally suppressed. So where we are, and I should just mention real quickly that in Uganda there's a lot of, it's a catchy, 1990 is very catchy. You see young people go out and educate communities about the first 90, the second 90, and the third 90, so it's really quite a catchy thing. And by 2030 we are now even talking about 95, 95, 95, so that we can truly end the epidemic. So where we are in terms of the 90, for the first 90, 76% of people living with HIV in Eastern and Southern Africa are aware of their HIV status, compared to 42% of those in Western Central Africa, and 70%, you can see the global figures. This is where we are on the second 90. So 79% of people living with HIV who know their status are on treatment. which really means that 20% are not either aware they have HIV, or if they're aware, they are not yet on treatment. And the third 90, which is around viral suppression, 83% of people living with HIV who are on treatment in Eastern and Southern Africa are virally suppressed, compared to 73% of their counterparts in West and Central Africa. So you can see from this is that really the challenge is more around diagnosis. I think if there's a way to ensure that the targeted diagnosis is yielding people living with HIV, the access to treatment seems to be more successful, and viral suppression also seems to be more successful, even though, of course, it's not yet 90, it's not yet up to 100%, but it seems like our challenges are quite significantly around diagnosis. So the other way to look at it is looking at the cascade. Instead of looking at the 90%, the percent who know their status, who are on treatment and all that, is to look at all people living with HIV as a denominator, and not change it as you're moving along the 1990 targets. And once again, 76% of people living with HIV in Eastern Southern Africa are aware of their status, compared to 42% as we saw in Western Central Africa. But if you look at the percent of all people living with HIV who are on treatment in Eastern and Southern Africa, there's 60%. So 60% of people living with HIV in Eastern and Southern Africa are on treatment, compared to 35%. And now you can begin to see the challenges in West and Central Africa as well. And when it comes to viral suppression, only 50% of people living with HIV, of all people living with HIV in Eastern and Southern Africa, are virally suppressed, compared to 25% in Western and Central Africa. And what this really tells us is that half the people living with HIV in Eastern and Southern Africa are transmitting the infection if they're sexually active or if they're pregnant. And 75% of those in Western Central Africa are transmitting the infection because they are not virally suppressed. And this is really, to me, the measure of where we are in terms of the depth of the epidemic, that we do have a long way to go, because so many people living with HIV are not yet able to be virally suppressed. This we know, but it's worth saying that men living with HIV are less likely to know their status than women, and this is across the 25 sub-Saharan African countries that we looked at. The progress that has been made on treatment has led to a reduction in deaths, and this slide is showing you the line. The line is the reduction in deaths, and there's been an increase in ARV use, and those are the blue bars over there. In Botswana, Rwanda, and Swaziland, and Zimbabwe in Eastern and Southern Africa, more than 75% of all people living with HIV are on treatment. We talked about viral suppression, but at least we know that more than 75% are on treatment. And these are the figures for Western Central Africa. Again, there's been a 21% reduction in deaths since 2000. ARV coverage is about 35% in 2016 in West and Central Africa. I think the concern in West and Central Africa has led to development of what it's called the catch-up plan, where people are working harder and more targeted in West and Central Africa just to address the needs there. When it comes to treatment for children, what we are concerned about is the fact that there is a stalling in the diagnosis for children. If you look at the percent of children who, HIV-exposed children who received a virological test within 2 months, there was good progress up until 2015, and then it started to stall. And this is an area of concern, because it means that if children are not diagnosed in time, they will not get treatment on time, and we know that will continue to be they'll continue to have challenges in terms of HIV disease. And this is shows you where countries are in relation to percent of children, HIV-exposed children, receiving a virological test within the first 2 months of life. And you can see that countries like Zimbabwe, Swaziland, and South Africa have more than 70% of their children receive the virological test within 2 months of life. But you can see many other countries are quite far behind, and this is an area that really needs a lot of work. And consequently, when it comes to ARV coverage for children, it's much less than that for adults. We know that. It's 51% in Eastern and Southern Africa, and only 22% in Western Central Africa, compared to 43% globally. I do want to say a couple of things about stigma. We know that this is a regression analysis of countries that have stigma, discriminatory attitudes towards people living with HIV and HIV status awareness. There's a negative correlation in relation to stigma and whether people are aware of HIV. If you look at each dot there represents a country. There is also a negative association between stigma and ART coverage, and there's a negative association between stigma and viral load suppression. What this tells us is that it's really, really important to fight stigma. It's not just providing services, but it's making sure that attitudes in the community, that people living with HIV are feeling that they will be supported if they come out to get treatment, as well as if they come to seek care. This is looking at the resource where we are. As far as Eastern and Southern Africa, we are probably close to what we need in terms of coverage at fast-track levels. But in terms of Western Central Africa, we've got a long way to go. And the one thing I should mention, if you look at, you may not be able to see it very closely, but if you look at the dark green portion of the bars, that is the percent of resources that is coming from domestic, from countries' own support. So you can see that has gone up, and in Eastern and Southern Africa, about 46% of resources are actually coming from countries themselves, which I think is laudable. And Western Central Africa, as I mentioned, and you can again see the proportion there. So in Western Central Africa, not only are there challenges in terms of being able to have sufficient funding to meet the fast-track targets, but also to have enough funding coming from the countries themselves. So just to wrap up, I'm not going to dwell on this much because there's many people who are going to be speaking in terms of the interventions that are needed as well as interventions that are being done. But I think from looking at where, just real quickly, where I was reflecting on is that it's really, really important to ensure that people living with HIV are virally suppressed so that we can maximize the returns in terms of impact of ARVs. It's also critically important to ensure that people living with HIV remain, people not living with HIV, people who are negative, remain negative, and really our prevention efforts need a lot of help. And I think in particular for pregnant women, because in many countries, the majority of pregnant women are negative, and we often don't seem to have very strong programs to help them remain negative. Certainly need to accelerate the implementation of the Western Central Africa catch-up plan, to improve pediatric diagnosis and treatment, to support young people while consolidating the gains for women as well as supporting men, and to ensure adequate funding and to implement adequate policies. So I will leave it at that. And but before I leave, allow me to just show you this little piece of work that's being done by young people in Uganda, young people living with HIV. Instead of throwing away their ARV bottles, they go around and they collect the bottles from everybody, and they make all sorts of things. And they make vases, and they make, there's one they're making even a dress. And I think for me, what this is that, you know, young people, their nature, their energy, their innovation is really incurable. And I think with proper support and with proper attention and funding, they will help us end this epidemic. So thanks very much for allowing me to be there.